So my name is Felicia, and I was diagnosed with metastatic breast cancer in October of 2003.
My name is Vicki, and I'm a caregiver for Felicia. I'm not sure how many years I've been doing this. I've known her ever since she was a teenager, so I've always been in her life.
So, like I said earlier, I am high risk for breast cancer. I have 3 generations, 11 women. In my mother's generation, there was never any discussion about metastatic breast cancer in general, or any testing. I don't know if that is, I think that's for 2 reasons. The first reason is their own family fear, and the second reason is that when cancer started in my family in the early 70s, that science was not quite as developed as it is in 2018. So my medical oncologist did tell me one day at our visit, so what do you think about genetic testing? And so I immediately thought that I've been diagnosed with breast cancer. The last thing I want to know is, did I pass this on to my son? And my son asked me during high active treatment, Mom, am I going to be diagnosed with breast cancer? And he was 16 at that point. It was devastating. I did not know how to answer the question emotionally, because I knew what it did to the women in my generation. I knew the fear. And so what I did to kind of adjust to the fact that I need genetic testing was, I had a girls' day and brought all of the women together, invited everyone to one of our homes for a potluck meal about breast cancer, and explained to them the importance of having genetic testing, why they need to have the genetic testing, look at our history. And this is not 1974 when our parents started developing breast cancer. This is 2018. There is prophylactic mastectomies, oophorectomies, and some of my first cousins followed suit, went and met with a medical oncologist and talked about our family history. They called me the oldest one in the bunch, so I had the privilege of going to all these appointments, and they made their decisions. And I finally, just recently, in the last 6 months, made the decision that I need to have the genetic testing done. So I'm in the process of working on that. And my medical oncologist and my OBGYN teamed up in different ways, because they were at different hospitals, and they gave me sound information and reason why I should have the oophorectomy. I did understand the connection between breast cancer and ovarian cancer. I did a lot of reading, checked a lot of reputable resources, and I committed to having the oophorectomy done. It was difficult. I'm not quite sure why it was difficult. I'm not quite sure why I had so much fear about the genetic testing. But what I've also keep telling the women that I interface with, use the fear productively. Okay, Felicia, get the genetic testing. It's time. It's overdue. Your cousins have done it. Be a good example. So you want to do it not only for yourself, but you want to do it because it gives the women in your family, the primary relatives, mother, grandmother, aunts, first cousins, sisters, an availability to make a decision about their own breast health and care for the future. So this is why I decided to do it, even though I had all these apprehensions and was terrified with the answer.